my name is Dr. Alberto Augsten. I am a board certified psychiatric pharmacist, and I'm also a board certified clinical toxicologist. I work at Memorial Healthcare System in South Florida, Hollywood, Florida. I've been there for over 16 years now. So I think seasonality changes is always something that we look for and keep an eye on for anybody with any psychiatric disorder, to be honest with you. I think if we're looking at folks who have bipolar disorder, classically we know that those individuals have the two possibilities. Those individuals have depression, aspects of depression that they suffer from. And then, of course, if it's bipolar 1, they have aspects of mania. Bipolar 2, hypomania. And so I think spring is a very unique time frame. This is a unique seasonality change, especially depending on geographical related changes. So somebody may be living in South Florida where I reside. We don't have many changes throughout the year when it comes to our weather. It's for the most part rather warm, a good amount of light for most of the year. I think the more you shift into geographical locations where those changes are more extreme, is where there may be more impact. I think on the opposite end, right? In times of the year where maybe it's colder, where there's less light, less sun availability because of the angle of the sun. I think we know folks are more prone to depressive-like presentations. But now, as you mentioned, going into spring, you have more sunlight, more time related to activities outdoors, changes. I think all those things can play a factor into individuals who are prone to having hypomanic or even manic related episodes. So there's a lot to digest there. I think the recurring theme in much of this is consistency, the ability to be consistent with our regimens, consistent with our medications when we take them, consistency with our sleep patterns. Are we getting the same amount of sleep per night? Are there changes there? I think this plays a key factor into our day to day, but especially individuals who have bipolar disorder. On this, there's some classic movies that have looked at individuals that live near the Arctic Circle and have experienced actual changes to their thought process, and even individuals prone to psychosis. Just having changes to your sleep pattern, and if one doesn't sleep enough, especially those people prone to mania and hypomania, that itself can precipitate manic-like symptoms in individuals. Behavioral health disorders, mental health, it's all about consistency, routines. Think about what we recommend in general for many of us. You have to treat the mind, body, and soul. Are we able to do the things that are important to us on a day to day? Are you able to maintain your routines? I mentioned medication routines. Are we taking them the way we're supposed to? Are you maintaining your exercise routines? Even if maybe somebody's not a full-fledged individual that goes to the gym, are they getting the right amount of time outside, outdoors? Do they go for walks? Do they spend time at the outdoors, or are you all cooped up inside? And then the same thing for activity. You're jumping into spring. Is your activity changing significantly? We get plenty of individuals, especially from families and parents who are concerned about their children who are in college, because this is a prime time. So if you think about it, spring coincides to spring break. It coincides to doing things outdoors. And if you're in that young time frame, if you're in college age and maybe you're going out and you're having a lot of fun, maybe going to parties, what goes with those parties many times is alcohol drinking, unfortunately, illicit substance use. And so it's very classic for us in the hospital setting to get individuals in the college age group that are admitted, maybe with a manic episode, maybe they're psychotic. And because of that, they were partying excessively, they were doing illicit substances. And many of them will say things to the nature of, I don't understand. My friends were doing this. Why didn't anything happen to them? My friends were doing the same thing I did. And why didn't they get hospitalized? And unfortunately, that's just the way it goes. Some people who are more prone to this, especially those with bipolar disorder, is something that you have to be more cautious with. And then the latter end of that, the non-partying, what coincides after spring break typically, tons of examinations. And as we approach the end of the term, you have finals. And so, what are a lot of these individuals doing? They're studying for long hours of the day. Maybe they're not sleeping enough. Maybe they're taking excessive amount of caffeine and coffee and sodas and things of that nature to keep them revved up. And then the major worry a lot of parents have, many of them may be taking stimulants to allow for them to study long hours, which in and of itself can precipitate manic-like episodes. That dialogue is difficult. I think it is important to note from my perspective. I have three children. I have two kids that are in college. And I think one of the discussion points is to say everybody needs this. Whether you're a young adult, teenager, young adult, adult later in life, we all flourish with routines and consistency, going to bed at a reasonable time, getting the needed sleep we all need, taking care of our bodies in a way that's important. I think that is a discussion that everybody benefits from, and to making sure that we have that dialogue, not to separate it and make them feel that they're suffering from something and it's unfair, instead of it being a dialogue that we would all benefit from similar routines and activities. And it's funny because I'm approaching 50, and I remember my grandparents would tell my parents and then my grandparents, and the classic response is routine is good for you. And it's funny because as we age, we start realizing how important routine is, and it becomes a factor in life, and it helps you de-stress. Actually, a lot of stress comes from not having routines in place and not establishing what's important for us and making sure that we maintain the things that are critical for us. Something as simple as taking our medications on the right time of the day. So I agree with you. Building that routine is crucial. It's very difficult in both states to. The report is generally individuals who suffer through this. It's very difficult for them to necessarily realize that they're starting to experience some of these changes. And I think, from my perspective, what we've learned is that depression-like symptoms and hypomanic and manic-like symptoms can be very different from person to person. So my view is all of us go through different things. All of us are not on a perfect spectrum. We fluctuate in highs and lows. And similarly, for those folks who have bipolar disorder, you need to learn your symptoms. You need to learn what are the things that you notice and identify are more prominent as you're going on to your low, to your depressive side. What is more prominent as you're going into the hypomanic, manic side. And being able to identify that, I think, is crucial, because typically it's going to be different depending on the individual. I love the focus of sleep. I think sleep is very, very crucial. I think sleep can identify individuals who are suffering from depression, and you will know, some people who get depressed may sleep too much excessively. But on the opposite end, some people who are depressed may not sleep enough and they're exhausted. And so identifying that, say, man, I'm really exhausted lately. I'm not getting enough sleep. That's a perfect sign. The same thing from those folks who are hypomanic and manic. Clearly, one of the more common presentations is that their need for sleep starts decreasing and decreasing and decreasing. Becomes, hey, I'm fully functional. I slept 3 hours last night. I'm ready to go. I'm on 2 hours tonight. I'm ready to go. I can study. Let's go out and party. Let's go have some fun. That may be one of the first signs that, hey, something's off. And I can take this information to somebody I trust, whether it's a therapist, whether it's my provider, whether it's a close friend and family member, and have a dialogue to kind of keep eyes on what's happening. Is it something with the structure that I'm doing that's resulting in some of these changes? Or maybe there's some changes that are happening in my medication regimen that needs to be addressed. I think, like I mentioned, routine is crucial. And so I think what many of us don't realize, like I said previously, is what's truly important on our routine. We have all this stress right now in the country because of what's happening at the level of the TSA and the airport. And many people are overly stressed and they have some flights to catch. And so they're not sleeping and then they're getting to the airport extra early and then the stress of the airport. And so it's identifying, what are these extra stressors that I may encounter. A good one, as I mentioned, as we approach spring, realizing, hey, this is a fun time for young adults, but at the same time, it could be very stressful because of the responsibilities that are happening just after spring break. So it's planning ahead, and so if I look ahead and I say, I'm going to be going on these vacations, maybe there's some stress and whatever have you. The plan ahead is I got to prepare for my studies ahead of time. I got to make sure I put the time in. Like I mentioned, I think routine is the number one component here, and it can really help out these individuals. Is one of the aspects that we worry about from a clinician perspective is that many individuals with bipolar disorder either stop taking their medication because they feel like they're doing well or everything's fine. This is especially true in a hypomanic or manic state. And so it's important to know that there's medications that can be utilized that we ensure that the patient's getting the medication by injection and it stays in their body for a month time frame and they're treated and they're doing well. And on the other spectrum, there's some medications that the concern is it causes side effects. And we know side effects typically is a burden that many patients will stop their regimen because of some of those side effects. And the classic side effects is things like weight gain, of course, things like sexual dysfunction. And to know that there are medications out there that treat bipolar disorder and the mitigation of weight gain is there, meaning there are medications that reduce the likelihood of that continued metabolic effect and weight gain. So it's good to be educated to know that options exist and there is great information available for those folks who want that.